Magandang hapon po sa inyong lahat at welcome po sa isa na namang edisyon ng Kalingang KaTribu Legal Diaries. Ako po si Elmer Navarro Manuel at ang pag-uusapan natin ngayong araw ay medyo napapanahon dahil hanggang ngayon ay may pandemya pa rin. Ito yung Universal Healthcare Act or UHC Act. At syempre kasama natin ngayon upang paliwanagan tayo para sa ating topic ngayon, ang Associate Lawyer ng Aranas Cruz, Araneta Parker, and Faustino Law Offices na si Atty. Alfred Campañano. Attorney, good afternoon po.
And good afternoon, Sir Elmer. Good afternoon.
Alright, long time no see, Attorney.
Kaya nga eh.
Okay, eto Attorney, ilang araw na lang, eleksyon na. So medyo talagang karamihan sa atin mga busy na, mamili kung sino yung mga iboboto sa darating na eleksyon. Oo nga, tama. Kasi talaga namang yung iba sa mga probinsya pa nila mga nakarehistro. Eto ngayon, Attorney, ang pag-uusapan natin is yung Universal Healthcare Act. Siyempre, para simulan natin to, no? Ano ba tong Universal Healthcare Act o yung Republic Act 11223?
So, yung Universal Healthcare Act, no? This basically is ito yung batas natin that aims to give or provide equal access to all Filipinos to quality and cost-effective healthcare. So, kung nababalitaan nyo, for example, it's a big issue in the States, ang universal healthcare. So, parang yan yung equivalent niyan dito sa Pilipinas.
Okay.
So, anong klaseng healthcare? So, ang mga healthcare, for example, could be preventive, pwedeng curative, pwedeng rehabilitative, or pwedeng palliative in nature. So, this law, which was passed in 2019, I think February, no, sometime in February 2019, aims to help, no, the Filipinos to have access to these kinds of healthcare. Kasi apparently there are studies that showed na prior to the Universal Healthcare Act, alam natin na ang laki din ng ginagastos ng out-of-pocket. Yun yung tinatawag natin out-of-pocket expenses for medical goods or health goods and medical or health services.
Okay. Ito, Attorney, nabanggit mo, no, access to healthcare ng lahat ng Pilipino. So, pag sinabi mong lahat, simula talaga kahit mayaman ka, kahit mahirap ka, o mas mahirap ka pa sa daga, pwede kang maka-access ng medical assistance galing para kaugnay dito sa UHC na to, Attorney?
Yes, actually, no. Kasi, in fact, even if the law says that it's really for everyone, whether anong class or ano man ang financial status mo in life, I think the beautiful thing about this law is it will really help, no, yung mga taong nasa lower income bracket sa Pilipinas. Kasi nga, alam naman natin, no, when it comes to healthcare, for example, yung tinakuha sa emergency room, o operation costs, so yung mga palliative care, such as yung, kunwari, if you're suffering from cancer or any serious illness na kinakailangan mo magpa-physical therapy or yung to help you adapt to the pain, etc. Yung mga ganung klaseng palliative care or yung mga curative, alam natin yan, yung mga ginagamot or yung mga kinakailangan ng operations to remove whatever, hindi man ako medical practitioner. But the idea here is, alam natin that this is quite expensive.
Okay.
So, when it comes to Universal Healthcare Act, the law aims to give the government a more active role, not only in my apologies.
Okay lang.
not only in sorry.
Okay lang, Attorney. Ayan, habang may inaayos pa si Attorney Alfred. Ang binabanggit ni Attorney is yung parang aim ng Universal Healthcare is mabigyan talaga ang lahat ng access sa healthcare services. Now, Attorney, ito, libre ba to para sa lahat? O para lang to sa talagang hindi kayang magbayad?
Actually, kung titignan natin siya, libre, hindi naman talaga libre ang pinag-uusapan dito. Hindi pa iyon ang tina-target ng Universal Healthcare Act. Especially so that this is still quite a very young law. Kasi nga, as I said, it was passed in 2019.
Yeah.
So, ang pinag-uusapan natin dito is to make, hindi naman niya talaga pinapangakong free, pero ang pinapangako niya dyan is that that access to this healthcare is for everyone. So, kung titingnan natin, then hindi mo kinakailangan mong problema sa pambayad, no? Para sabihin natin, para ma-avail mo ang healthcare services. So, in fact, this law intends to create will make it a program to the National Health Insurance Program na tinatawag nila, na kung saan all Filipinos are basically classified into two categories. Meron kayong mga direct contributors and you have your indirect contributors. So, is it free? To a certain extent, yes, especially for those indirect contributors, because it will be the government itself who will be subsidizing subsidizing their access to this healthcare. For direct contributors, it's akin to kung I think may mga viewers na tayo na may experience to that, na yung parang kapag may pinaoperahan ka, for example sa appendix or whatever part of your body, parang makikita mo na may binabawas na or may binabawas sa mga kinakailangan mong bayaran.
Okay.
So so parang in terms of cost, parang ginagawa pa niyang pababain. So for direct contributors, it's possible na meron pa din kayong share because obviously meron naman kayong pambayad.
May capacity para magbayad.
As far as yung mga basic packages that is determined by the DOH and PhilHealth, then that in itself may be free in the long term, but right now, since we're transitioning to this, baka ang realistic goal is to make it affordable for everyone.
Okay. So kumbaga sa yung mga hindi kaya magbayad, pwede nyong makuha ito ng libre o bawas ang bayad. At yung sa mga may kakayahan naman magbayad, discount ang magiging dating nitong Universal Healthcare Law. Attorney, implemented na ba to sa ngayon, itong UHC law na ito? O under amendments pa ba?
Actually, implemented na yan. No, parang if I recall correctly, meron na yung implementing rules and regulation. So, in fact, when I was doing my readings regarding this law, may mga local government units na that are starting to implement the Universal Healthcare Act. Kasi it's not just about, the implementation really is on how to make it accessible and affordable. So under the Universal Healthcare Act, magkakaroon pa ng integration of the local healthcare system in a provincial level or in the city level or in the provincial level. So yan yung isang nakikita natin that's being slowly implemented. So another one of the implementing rules and regulation is ina-ensure din nila na that PhilHealth and the DOH will also create this so-called healthcare providers network, na kung saan meron tayong parang possibly na for let's say public hospitals or public clinics na may mga rumoronda na healthcare service providers, so yung mga ganyan. And then meron din tayong in the implementing rules and regulation, there's also an incentive for public clinics and public hospitals to improve on their service by allowances of grants or mga parang sponsorship if the goal is to develop the healthcare practice in that hospital or in that clinic. So it's there. It's as far as yung pag-create ng network, I think PhilHealth and DOH is already creating that network. Pero kasi considering that the local healthcare system is integrated in a province at the provincial and at the city level, then the initiative would somehow also be in the local government unit as well. So as far as implementation, to simply put, it's already being implemented.
Okay.
Kaya lang syempre, as I've mentioned, this is still a young law. So I think hindi pa natin mararamdaman ng full effects or full benefits of this Universal Healthcare Act for some time.
Okay, alright. Ayan, malinaw pa mga kaibigan. Implemented na po ang Universal Healthcare Law. Pero syempre, hindi pa rin masyadong malinaw para sa lahat dahil syempre baka kulang nga naman sa impormasyon kung paano nga ba ipatutupad itong nasabing batas na to. Alright, attorney, magbe-break muna tayo saglit. Huwag po kayong aalis at babalik pong muli ang Kalingang KaTribu Legal Diaries.
Salang tayong lahat, isang Pilipino na magiting at masipag. Yan po ang Pilipinas sa unity na pagkakaisa.
Mga impormasyong direktang makukuha mula sa sources at diretsahang usapan. Yan ang ating daming sa inyo sa programang Straight Talk. Samahan nyo kami sa makabuluhang talakayan live tuwing Martes alas 10 ng umaga sa official Facebook page ng Daily Tribune at Tribune Now on YouTube.
Kami,
Sa mga walang boses sa lipunan, si Harry Roque ang spokesman ng bayan. Attorney Harry Roque sa Senado, number 54 sa balota.
Ang asawa ko po ay kameraman na kasama sa lapas lang sa Maguindanao Massacre. Si Atty. Harry Roque. Hindi po niya kami nakakalimutan.
Sa mga walang boses sa lipunan, si Harry Roque ang spokesman ng bayan. Attorney Harry Roque sa Senado, number 54 sa balota.
Nagbabalik pong muli ang Kalingang KaTribu Legal Diaries at syempre kasama pa rin natin si Atty. Alfred Campañano upang pag-usapan ang Universal Healthcare Act. Alright, attorney, ito, syempre, Universal Healthcare Act nga itong pinag-uusapan natin, ano. Kasi dito sa bansa natin, syempre, hindi lahat halos ng bansa, ng lugar, lalo na sa mga malalayong probinsya, merong mga pasilidad, yung mga ospital. Paano makakatulong yung Universal Healthcare Law sa mga gantong klaseng ospital, mga let's say mga public hospitals or private hospitals din sa mga malalayong lugar? Kasi syempre, yung iba minsan pagka nagka-problema, hindi, transfer ka dapat dito sa mas malaking ospital na to kasi wala kaming gamit. Matutulungan ba yung mga ganung ospital ng Universal Healthcare Law, attorney?
That question, it's quite close to home for me.
Mhm.
So, but I think the Universal Healthcare Act is has seen this dilemma or this concern.
Mhm.
And I think that's one of the things that I've mentioned a while ago, na kung saan the introduction of the local health system is in a provincial and a city magiging provincial-wide or city-wide na siya as the case may be. So, yung development ngayon ng practice or the healthcare system is now is relatively delegated na siya to the LGUs.
Okay.
So in that sense, mas mayroong sila, they have a better feel, they have a better understanding of the topography, the demograph, yung location, kung saan doon sila makakapag-strategize from emergency cases
Mhm.
or from allowing or for information dissemination or even for just making sure that people will go to their hospital and not opt to either just stay at home
Oo nga.
or look elsewhere for healthcare services. So that's one of the things na na ini-aim ng Universal Healthcare Act, na kung saan ini-introduce na ngayon yung participation ng local government units in to ensure na even yung mga nasa far-flung areas will be able to access
Mhm.
this more than adequate healthcare. So that's one. And then another thing is I've also mentioned a while ago is yung sa mga public hospitals and clinics may mga incentives sila na to allow them to be more competitive in
Mhm.
providing for healthcare services. So yung tulad ng sinabi ko kanina, yan yung pag-provide mo nga ng mga grants, financial or non-financial,
Mhm.
as the case may be. Tapos another thing is makikita mo dyan na mas clear or mas delineated na ang roles ng mga agencies. Kasi I think a good case there is yung mga ginagawa dati ng mga ating mga lower income earners na kung saan nanghihingi pa sila ng funding from PCSO
Yan, oo,
or
tama.
from I think may mga I've heard nanghihingi pa sila from PAGCOR or even from their
Oo,
from
tama. Yung
from
mga
their
local officials nila, nilalapitan din
and
nila.
from their local
Oo.
officials. So the beautiful thing about the Universal Healthcare Act is that it established a special fund, no? Na kung saan doon na kayo kinakailangan lumapit. And as far as these agencies that usually do give assistance, financial assistance for healthcare access, then sila rin meron silang contributions to this National Health Insurance Program.
Okay. Eto attorney, since sabi mo nga nabanggit nga natin kanina no na dapat itong UHC law na ito ay para sa lahat ng Pilipino. Ano ba yung mga requirements ngayon na kailangan para ma-avail mo tong or para makapasok ka dito sa ganitong klaseng healthcare system? Kailangan mo ba ng mga IDs? Kailangan ba miyembro ka ng PhilHealth? May mga ganong requirements pa ba, attorney? Lalo na, syempre, yung mga talagang mahihirap, walang kakayanang kumuha ng ID kung may bayad. Pero alam ko, meron na tayong national ID system din na libre, kumbaga, na pwede kang magpakuha ng ID na ibibigay sa iyo ng libre. Hindi ko lang sure kung talagang implemented na to o meron na bang ibang merong hawak na ng national ID, attorney.
As far as dun sa unang mong tanong, no, yung do you have to be a member of PhilHealth?
Mhm.
Ang understanding ko of the law there is you don't need to be a member of PhilHealth,
Okay.
no, to avail of these services. So, for example, if wala kang contribution, as I've said, you belong to those indirect contributors. So,
Mhm.
basically, ito yung mga tinatawag nating subsidized individuals. If you're not a member of PhilHealth, then it's not a reason for you or it's not a reason, supposedly, to refuse rendering healthcare service as
Okay.
provided for by law. So, if you're not a member, then they will get identification, any proof of identification on your end, so that you will be registered in the National Health Insurance Program.
Mhm.
So, the law does not discriminate, no, as to membership. So, that's the first thing there. So, as far as an ID is concerned, hindi siya dapat magiging reason to refuse service
Yan, oo.
or to refuse healthcare access. However, the IRR reasonably requires na at least ma-establish mo yung identity mo.
Ayan.
Because of course, we will of course need your names, your age, yung mga ganyan.
Oo, yung mga address.
At saka yung mga, yung mga standard information. And at least, makilala din nung hospital who they are treating.
Okay.
So,
Oo.
it's possible that the hospital will request any proof of identity. Otherwise, baka dun ka ma-deny ng healthcare service.
So,
Kasi syempre, kailangan mo patunayan who you are.
oo.
That's quite important.
Siguro kailangan may mga sedula, birth certificate o yung mga ganon kung merong marriage certificate. Alright, ito attorney, saan ba kukunin ng pondo nitong Universal Healthcare Law? Yung sinabi nyo kaninang parang meron ng special funds para dito. Saan kukunin ng gobyerno itong mga funds na ito?
Yung funds, no, for the special funds, if I recall, from what I recall, kukunin yan of course with yung mga from the direct contributors. As we all know, meron tayo for those of us who are employed or yung mga professionals or yung mga business, yung mga voluntary contributors. Then meron din sila syempre gino-contribute. So that's one. Yung mga PhilHealth, basically your PhilHealth contributions. Tapos of course meron din tayo because of the law na nagke-create ng special fund na yan, the IRR likewise will source the funding for this program sa General Appropriations Act. So magkakaroon yan ng separate item para mapondohan ng yung National Health Insurance. Tapos of course, meron din contributions from PCSO and PAGCOR. No? That's one. That's another. And as far as yung sa taxes, if I recall correctly, yung mga sin taxes na tinatawag, doon din pwedeng kukuha, no, ng pang-fund for health insurance because of course it makes sense. Diba, sin taxes are imposed on those that usually pose a harm to yourselves or to others. So at least nakukuha mo yung benefit to finance combating the societal ills.
Okay. Attorney, di ba usually karamihan sa ating mga Pinoy, lalo na yung mga nagtatrabaho sa mga kumpanya, merong mga HMO na tinatawag o yung mga insurance or yung mga medical benefits din na galing sa kumpanya. Pwede mo bang isabay ng gamit yan? Kunwari, na-admit ka sa ospital, tapos pinaprocess na ng HMO yung mga ibabawas or yung mga hindi mo babayaran. Pwede mo bang isabay dyan ngayon yung mga benepisyong makukuha mo under dito sa Universal Healthcare Act?
Right now, I think yan yung medyo gray area pa. But if I'm going to apply the basics of insurance, I think hindi ka pwede magkaroon ng double recovery when you're talking about health insurance. So, you have to choose one or the other. However, I was going over the IRR of the Universal Healthcare Act. There is this principle of complementarity between your private health insurance or yung mga HMOs mo and that of this National Health Insurance program. Because if I recall from my understanding of the IRR, the DOH and PhilHealth will be creating benefit packages depending on the needs or depending on the contribution or yung mga ganyan. Pwedeng basic or ward accommodation plus, say for example, operation or plus palliative care or plus yan. Parang magagawa sila ng, think of it like a menu, no? Na parang package A, B, C, D, ganyan. Ngayon, ang understanding ko dun sa complementarity is, if you choose, for example, package A, and then at the same time, you will try to recover from your private health insurance, then magkakaroon ng complementarity dyan. So, we mean by complementarity is, whatever that package you're availing for, no, under the National Health Insurance Program, yan na yan.
Okay.
So, meaning hindi siya pwede mag-overlap. Kasi nga, di ba, I suppose, bawal ang double recovery. So, however, what is not shouldered by the package, additional services, additional costs that are not covered by the National Health Insurance Program, dyan mo na pwedeng i-channel ang costs sa private health insurance mo. Such as, for example, to cover the cost of amenities and other healthcare goods and services. The IRR actually still states that PhilHealth and DOH will be coordinating with HMOs with this. So I think we're going to expect some sort of guidelines once negotiations have been done or once coordination or discussions on this matter has been made between PhilHealth and your private health insurance providers.
Okay. Alright. Yan po, mga katribu, malinaw na po ang mga nabanggit namin ni attorney tungkol dito sa mga ibang provisions ng Universal Healthcare Law. At huwag po kayong alis, magbabalik pong muli ang Kalingang KaTribu Legal Diaries.
Boses natin sa Kongreso, PG Party List. Kasangga mo, balot 108 iboto. PG Party List, basic good. Atin to, magkaisa ng marinig ang mga hinaing. Young and active leaders sa Kongreso, ang boses natin. Tandaan at iboto, balota 108. Civilian realize the projects we dreamed of. PG Party List, vote 108 na. PG Party List, kasangga mo, balot 108 iboto. PG Party List, boses natin sa Kongreso. PG Party List, kasangga mo, balot 108 iboto. PG Party List, basic good. Atin to, PG Party List, atin to.
Alamin ang latest entertainment at sa mga paborito nyong celebrities kasama si Pocholo Concepcion sa programang What's Up. Makibanding at kwentuhan kasama ang mga kilalang personalidad sa entertainment industry. Sama-sama natin silang kilalanin at silipin ang makulay nilang mundo every Tuesday at 2 p.m. Kaya sit back and relax lang kayo mga katribu. Hanapin at ilike ang Daily Tribune Facebook page at Tribune Now on YouTube. Dahil sagot na namin ang masayang kwentuhan, dito lang sa What's Up. Fun and inspiring na kwentuhan? Sagot na yan ang programang Spotlight ng Daily Tribune. Makipagkwentuhan at kilalanin ng iba't ibang personalidad na kilala sa kani-kanilang larangan. Manood at makinig sa mga inspiring stories na kanilang ibabahagi kasama si Nina Ventura at Jojo Silvestre. Be ready ng mamangha at matuwa every Thursday alas 2 ng hapon dito lang sa Daily Tribune Facebook page at Tribune Now on YouTube.
Nagbabalik po muli ang Kalingang KaTribu Legal Diaries at syempre kasama pa rin natin si Atty. Alfred Campañano. Alright, Attorney, eto, Tribune tayo ngayon. Para sa ating Tribune ngayong araw, ang sinasabi dito, doctors in private hospitals are on par with those practicing in the public sector, but private facilities are much better equipped and treatment is typically faster. Doctors and nursing staff in public hospitals are highly proficient, but public healthcare in the Philippines faces limitations. Alright, ito, sinasabi dito, attorney, yung mga doktor natin tsaka mga nurses natin, magagaling talaga. Ang medyo nahihirapan lang sila, yung ospital na pinagtatrabahuhan nila, kung kulang talaga sa pasilidad. Lalo na karamihan dito, ito yung mga public hospitals nga doon sa mga malalayong lugar. So, anong take mo rito, Attorney Alfred?
Well, I think it's true. kasi,
Tama.
kasi sometime in 2009, I think, or kailan ba ako nag-start na mag-high school, if I recall correctly, there was a high demand for nurses. During nagiging parang that's one of our main exports, apparently. Naalala ko nasabi na ganun. But I think in terms of healthcare training and healthcare training and education and medical education, I think the country is not really backlagging, no, in terms of qualifications and skills. But again, skills can only take you so far if as far as your equipment, the appropriate medical equipment is not there.
Tama.
So, yan yung isa sa mga bagay, I suppose, na kung saan dun kinakailangan ng funding ang ating Kaya dun pumapasok ang Universal Healthcare Act na nag-establish na sila ng ways to make public clinics and public hospitals to be more competitive, no, in terms of their services. But I suppose the last thing I just like to add to that is yung fact lang na na as far as healthcare services are concerned. And I think this is just a personal observation.
Mhm.
It's not, maybe I'm wrong, possibly. Pero I think there's not enough incentive in the country to invest on R&D
Tama.
on health and medical uh, in the healthcare and medical and healthcare field. So I think yan yung siguro maybe no na maybe dyan tayo supposedly nag-gear towards to, so that hindi meron tayong incentive for healthcare practitioners to actually stay and serve in the country.
Okay, alright. Maraming salamat sa oras mo ngayong araw na to, Attorney Alfred. At bago tayo magtapos, any parting shots, Attorney?
Wala naman. I think just stay safe and healthy. And then, lastly is malapit na ang election. So don't forget to vote.
Ayan, tama.
And
Lalabas na
God
si Vote Wisely. Yan.
and God bless us all. Whatever happens in the elections, nandito pa din naman tayo and we got
Yes.
to live with it.
Alright. Maraming salamat po, Attorney Alfred Campañano. At mga katribu, maraming salamat din sa pagsama sa amin ngayong araw na ito. And you can watch us live on Daily Tribune's official Facebook page every Fridays at 3:30 p.m. and on Tribune Now on YouTube. Ako po muli si Elmer Navarro Manuel at maraming salamat po sa panonood ng Kalingang KaTribu Legal Diaries. Happy weekend po!